Here's the case that we're discussing of this lower second molar. We can see here the previous endodontic treatment, and we also have the radiolucency associated with the root. If we look at the tooth a little bit more closely, we can see that this canal seems to be fairly well filled, pretty close to the radiographic terminus, yet we have a periapical radiolucency here. So what we also see is a lingual, a second root. If we examine the slices as we come down, and we examine this panel right here, the axial version, what you'll see is the distal canal at this point in the tooth looks pretty centered in the center of the root. There's our mesial canals. So this looks pretty good. But if we go a little bit further, you will watch the lingual canal bud off. The lingual root will actually come off right about here. And we'll start to see the invagination right in this area and in this area, coincident with the area of radiolucency. And there it is. There's the separate root at this level. Very, very close to the end of the tooth. So it's going to be extremely difficult for us to be able to get in here and go through this part of the tooth. Not only that, but if you look really carefully, we can also see there's very little in the way of a canal here. Really can't see any sort of distinctive canal. So this would be an extremely difficult case to retreat conventionally. Unfortunately, if we look at the buccal cortical bone, it's really, really thick. And if we measure the distance, how far do we actually have to go to get to this root, we're looking at probably 13 or 14 millimeters in to the mandible to be able to actually reach this root. And even if we did and we decided we're not going to treat it, we're just going to resect it, we'd have to resect it probably up at this level, which would certainly compromise the length of the distal root probably to about this level. So all in all, when we look at this radiolucency in a patient that is completely asymptomatic, there's a lot of motivation to do nothing, especially in the case where the patient has been asymptomatic since the case has been completed. It's nice to have some films to compare from the initial endodontic treatment, but in this case, we were not able to have that. So in the case of this young patient, she decided that she wanted no treatment, and we will leave it and bring her back annually to see if the area enlarges or if she has symptoms.